Meanwhile, there's other vaccine news. The COVID vaccine for kids under 5 could be available in about 2 weeks, pending approval from the CDC.
Lots to talk about as usual with UW Health Chief Quality Officer Dr. Jeff-Pothof. Welcome.
Hi, Dr. Pothof. Good to see you
guys.
So let's talk about this new vaccine. Does it make a difference how it works? This makes your body, this puts the protein in your body.
Right, so for a lot of us, it doesn't make a difference. You know, some of us are happy to have carburetors in our cars, some of us are happy to have EFI, but for those who are fans of the carburetor, this vaccine might be for you. It's a protein that's made in a lab. That protein is actually the spike protein of COVID-19. When you inject that into someone, they create that immune response, compared to, say, the mRNA vaccines, which is the recipe to create the spike protein that we inject that's quickly taken into the cells. The cells make the protein for us. They do all the hard work, and then our body reacts against the protein, and you get immunity in much the same way.
So a more traditional vaccine, is the thinking, would persuade more people who may be reluctant to get vaccinated to try it.
Right, because one of the things that we hear is, you know, mRNA technology hasn't been used in vaccines specifically much in the past, but this method where you create a protein has been around for decades and is really the basis by which most of the vaccines that people are used to right now are made. So if the argument is, hey, these vaccines are too new, I don't trust that technology, that kind of goes away when you look at the Novavax vaccine.
Another tool in the toolbox.
Yeah, I mean, more tools the better, right?
Yeah.
Let's talk about the kids getting the vaccine now, maybe in a couple of weeks?
I think maybe. So we have this meeting coming up on the 15th. It'll be interesting to see if they approve the Pfizer vaccine for 6 months to 5-year-olds, the Moderna one of one or the other. If they do, the CDC will likely be quick to potentially endorse that, probably without a lot of change. And then it's a matter of making sure that vaccine's available in pharmacies. Because it's a smaller dose, it's not just a booster of the same thing that we have. It could take a little bit for supplies to catch up to demand. But so early on, maybe sometime after the 21st or so of June, you might be able to find it. Probably early July, middle of July, it'll be very easy to find. But I think something's coming.
That's good news.
Convincing parents to have their children vaccinated. That's the trick.
Yeah.
The kids aren't going to ask for it themselves.
Definitely not. No, the vaccines are still doing a very good job preventing serious illness and death. But there are a lot of cases of these kind of at-home, inconvenient sicknesses where everybody in your social circle is testing positive and getting sick now. Is that just because of the contagiousness and transmissibility of this Omicron variant? Or what else, is something else going on?
There's two factors there. One is Omicron is very much more transmissible, so the amount of time you need to spend with someone who has these Omicron variants before you get enough of a dose of virus to get infected is very small, I mean, a minute, seconds. The other thing is that our vaccines are predominantly still targeted at that original coronavirus strain, so it makes sense that they're not quite as effective against these variants that keep on happening. But the good news is that even though the ability to protect against any symptoms at all starts to wane shortly after you get boosted, you know, 3-4 months later, the ability to protect against severe disease, keep you out of the hospital, keep you from dying, is still very good. That really is the value of the vaccines right now.
And we're still watching the hospital numbers and death numbers. That's the key.
I think that's the key. We talk a lot about cases, and for some people, if you're immunocompromised, you need to know what's going on with cases because that portends how likely you are to come into contact with COVID if you go out in the community. For a lot of us, the real metric we have to watch is hospitalizations and deaths. How many people are getting really sick? Is that taxing the health system? Otherwise, cases in and of themselves may be bad for employers who are trying to run businesses and everyone's at home sick, but for health systems and people, you know, living or dying, not as big of a deal.
Well, we're doing pretty well here, right?
Do you think people who are vaccinated and boosted think that they are more protected than they actually are, and so they're taking more risks? Could that be what's driving some of these statistics?
You know, it could be that they feel like they're more protected against any symptoms at all, or, you know, they may actually realize that their protection against any symptoms isn't great, but their protection against severe disease is good. So they're using that as leverage for, like, I really want to do this thing, and I know I might get sick, but I'm probably not going to go to the hospital. That's a whole lot different than, you know, a year and a half ago where it was like, well, I really want to do this thing, but it could kill me.
Take the risk, right? Yeah.
All right, more to talk about than we have time as usual.
As usual.
Doctor, thanks for being with us. We'll see you next week.
See you next week.